If you just tweaked your low back, then you should try stretching out your hip flexors, stretching out your hamstrings, and then doing penguin walks. Now, if you're familiar with all these 3 exercises, then that is it for this video. Unsubscribe. Okay, I'm kidding. The details in these 3 exercises are what matters. How you sequence these 3 exercises when you're doing them are what matters. So I would encourage you to watch the rest of the video to maximize the benefit of these 3 exercises to reduce your low back pain. With a hip flexor stretch, get into a kneeling position and make sure that the shoulder, hip, and knee of the side that you're stretching are completely in line. Remember, this is not the time to shift your pelvis forward when you're doing this exercise. However, it is a time to squeeze your core muscles and to squeeze your butt muscles at the same time to rotate your pelvis counterclockwise while the shoulders are aligned. If you're not sure that you're doing this right, then place your hands on your hips with the thumb along the side and back of your hips. Now try squeezing the core and glute again, and you should start to feel the pelvis rotate counterclockwise with the thumb rotating down towards the floor as the rest of the fingers rotate upwards. And at that point, you should feel a stretch right along the hip flexor. And usually when I have patients do these that are very tight along the hip flexor, they make a face that says, I got the muscle. I didn't know I had a muscle there that I'm stretching. So look out for that as well. Now, when you finish off with the hip flexor stretch, you want to move to a hamstring stretch. Now, I'm going to show you how I like to do this. I like to use a box, or you can use a chair, and if you want to disrespect your coffee table, you can definitely use a coffee table for this stretch. Get one of your heels up on the chair, box, or coffee table, and make sure that you're pointing your toes up. Very important. Keep the knees slightly flexed. Also very important. And then apply a light pressure right through the heel into the box or whatever item that you're using to place your foot on. Now lean forward just enough to get a light to moderate stretch along the back of the thigh, along your hamstrings. Here's the caution with this one. Do not allow your back to round. In fact, you should probably record yourself doing this to see if you're rounding your back. Keeping your back neutral will help you maximize the stretch along the hamstrings. And if you're sensitive to flexion, it will protect you from increasing your low back discomfort and pain. After you've done with the hamstring stretch, you want to move on and do penguin walks. Now, with the penguin walks, you need a looped resistance band, but if you don't have any, you can definitely grab a belt and use the belt to do the exercise. Place the looped resistance right above the ankles and engage the glute and core to tilt the pelvis counterclockwise like we did earlier. Now with both feet pointing forward, with both feet pointing forward, with both feet pointing forward, you want to take mini steps forward, maintaining shoulder width stance throughout. You want these steps to be roughly half your foot length. And remember to keep the pelvis tilted counterclockwise throughout the entire exercise. You should definitely feel your butt muscles working with this particular exercise. But if you're feeling it anywhere else, do let me know in the comments. If all of these exercises are done right and frequently, it can be extremely helpful to help your back reset. I once gave this set of exercises to a patient, and when she came back for a second visit, she was like, wow, PT actually works. My back feels completely better. And then I never saw her again. Believe it or not, despite people getting better, I rarely take credit when I have patients that get better from low back pain. But I think that's a story for another time. Make sure to go see an excellent physical therapist to help you with the rest. I gotta go explain to my primary physician why it's been so long. All right, bye-bye.